Nathan has said I'm a practitioner by background, but I'm in a privileged position at the moment to be able to do a great deal of concentrated thinking about the issues of applying practice in the real world, relating that to research, and helping practitioners, helping politicians and policymakers think about these things. My job today is to play in a kind of tag team with Michael, who's going to follow and talk about the American context to place-based approaches. I'm going to talk about the Australian context, and if I can get this to work, I'll tell you. Pardon? Is it on? Does it have an on-off switch? There we go. I found the on-off switch. Always helps. I'm going to be talking about why we need to rethink how we support families. Marie has talked about this in a way, and some of the strategies her department is using, what we've tried so far, how effective these efforts have been, what we need to do. Then we get on to place-based as one of the things we need to do. Some Australian initiatives, evidence of efficacy and key features, some resources, implications and conclusions. I'm going to go fairly fast through these slides. They will be made available to the conference, so there's no need to take notes, even if you were able to. Why do we need to rethink support for families? Well, I'll try and read my own notes. Okay. The recognition that we need new forms has emerged in response to a number of factors. There's social and economic changes. I would call this social climate change. It parallels climate change and comes from the same factors. We've experienced dramatic societal changes as a result of a whole series of interconnected factors, globalised, national and local levels. And in general, these have been enormously beneficial, but they've come at a cost that we're only just beginning to understand. One result is there have been significant changes in communities, in families, and in the conditions under which families are raising young kids. And this is one of the most important things. We've got to realise that the change that has taken place has been far more rapid than at any other time in our history. The impact of this change, it's had a significant impact on children, on families and communities. Many families have benefited greatly, but a significant minority have not. And there's evidence of worsening or unacceptably high levels of problems in a minority of children across all aspects of their development. And significant numbers are arriving at school poorly equipped to benefit from the social and learning opportunities that schools provide, and schools then have difficulty making up that gap. There's also an increase in the number of families with complex needs, precisely the families that Marie was talking about, more pockets of intergenerational disadvantage, underachievement, poor health and developmental outcomes. In addition, we've got a widening gaps between the rich and the poor. We've got to be careful about this kind of statement. We've got books like Andrew Lee's book on Battlers and Billionaires, which tells us the full detail of what's happened to inequality in Australian society. It's not nearly as unequal in some other societies. The point here that we have to take on board is that everybody in our society has benefited from prosperity that has come with the advances that have occurred in the last 50 or so years. But the gap has widened at the same time. So although the poor are less poor, the gap between them and the rich, and it's the gap that matters. The gap is corrosive in ways that we haven't fully understood. Changes in the nature of the problems we face. And this is a very important message. The nature of the social problems facing society have altered. They are now more likely to be what we call wicked or complex problems. They're not able to be resolved through traditional service-driven approaches. Wicked issues include climate change, poverty, Indigenous disadvantage, child abuse, family violence, obesity, crime, natural resource management, a host of things. Complex problems that are not easily able to be managed. These have changed partly because some of the simpler problems that we faced earlier in our society have actually been resolved, particularly in the health area. But problems have also changed as an outcome of the social and economic changes that have occurred. And these are interconnected in highly complex ways, and we don't know exactly how they interact with one another. The issue of childcare, of child protection, is a classic complex or wicked problem. It has multiple causes. There isn't a single thing that you can do about it. If we look across all jurisdictions, everybody has got problems with child protection and child abuse, and we haven't got easy ways of sorting it out. The whole place-based solution is an attempt to try a new approach to addressing the issue of complex problems. Here's a complex problem. This is a map of obesity. I've got a pointer here. Sorry, you guys over there, you're going to have to look at this one. There is a circle in the middle, which is an interaction between your psychology and your physiology. And then over to the left, there are social, there's food production, and there's local food access, and there's physical activity, and there's a whole series of things. This shows how multiple influences focus on obesity, and that trying to fix obesity, if we knew how to fix it, we would have fixed it now. We haven't got answers to it because it requires multiple level approaches. That's the nature of any of the complex problems that we're grappling with. The impact on services of rapid change is that the service system hasn't changed significantly. If we think about the way we do childcare or preschools, or a number of services haven't really altered and struggling to meet the needs of the most disadvantaged groups. So there are many kids who don't get the help. I'm focused particularly on the preschool area, and it's the preschool area where we don't have constant contact. We know where the kids are when they're born, we know where they are when they start school, we have no regular way of tracking them in between. There's evidence that a minority of vulnerable families make little or no use of existing services and are hard to engage, and those are often the ones with greatest need. They are least likely to have to access services, and there's also a tendency for disadvantaged areas to receive the fewest services. They've got the worst transport, nobody who delivers services actually lives in the area, etc. And the planning of services is heavily segmented, with government departments operating autonomously, etc. And government departments are now attempting to address that, as we'll see. Here's a picture of, this isn't childcare. This is a kid in Melton, an outer western suburb in Melbourne, trying to find their way through to a service for speech therapy. It is a complete mess with barriers and assessments, and there isn't a simple way of getting through. You'll be familiar with this kind of pattern. We've got new knowledge about child development, which is also shaping our thinking. And this is a very important story. This has changed how we view the early years. It should become apparent that it is no longer sufficient to think of this period as being about keeping children healthy and safe while allowing development to take its course. We still have a residual thought that that's what we're doing until they become old enough to educate formally. Instead, we need to be taking steps to ensure that children are provided with early childhood environment and experience that build competencies and skills from birth. So this is an issue that we're grappling with the Productivities Commission on Childcare at the moment. And then there's arguments for investments in the early years. We're familiar with this kind of argument, which is the economists getting in on the act and analysing the data. And the important thing to take on board in this changed world, national prosperity is seen as dependent upon the productivity of its citizens. This is why governments are becoming more interested in the early years, because the stakes have risen. It's no longer acceptable for children to arrive at school, etc. Moreover, economic analysis by Heckman and others show that investments are more cost-effective, etc. So you get this kind of model showing you get a bigger bang for your buck if you spend in the early years than if you do it later. It's harder to make a difference later on, it costs more, it's less effective. And Heckman says, in short, to foster individual success, greater equality of opportunity and more dynamic economy, we need a major shift in social policy towards early intervention, with later interventions designed to reinforce these early efforts. Early intervention does not inoculate a child against later adverse experiences or ongoing adverse family environments. So what's been tried? In Australia, governments at all levels have tried to address these things. We've got a national early childhood development strategy, a national framework for protecting Australia's children, national early years learning framework, a national quality framework for early childhood education. We've increased investment in early childhood education and care. We've got the Early Childhood Development Index, now inexplicably renamed as the Early Childhood Development Census by a government which wishes to make its mark. You'll notice that these COAG innovations date from a certain period, and some of them may appear to be at risk. But they've been enormously beneficial, in fact, in providing a focus for national work. They've got a number of features that we're trying to find more effective ways of reaching vulnerable children. We're extending the provision of early childhood education, ensuring that all kids arrive at school ready to learn. Reducing child protection rates has been a big focus. Monitoring kids' development, improving the quality of services and increasing the use of evidence-based practices. That's the focus of those things. But governments have tended to focus effort on building better coordinated and more effective service systems, with less effort on building effective and more supportive communities and improving the interface between communities and services. I was very encouraged to hear Marie talking about co-design as an important principles. Governments have tended to place more reliance upon killer programs, evidence-based programs that address the presenting problem. We can give you a P parenting program, rather than looking at the systemic and ecological conditions that lead to the people having problems in the first place. How effective have we been? We haven't had a major impact so far. That's the big message. We haven't actually changed things. And the reasons may be, well, we haven't been trying long enough. If these things have taken several decades to occur, it may take us several decades to remediate. They're not comprehensive enough. They're not sufficiently well integrated. They're not involved families and communities in the planning, service delivery and evaluation. That's the co-design message. They've not been based on a clear understanding of why problems occur, and that's an important part of the picture. They've been unduly reliant upon services, particularly evidence-based programs, and they've failed to address the underlying causes of problems. Failed to address them because we haven't always understood them, and we have a service mentality. So what do we need to do? My colleague and I had a go at this recently for a Benevolent Society report that came out last year. We say in order to reduce the likelihood of long-term outcomes for children experiencing significant autism, a multi-level ecological approach to early intervention is required that involves programs, community and system-level changes to address structural and wider social factors, etc. No single solution is going to work. So what do we need to do? This is our suggestion. I'll leave you to follow up with the report if you haven't already seen it. We've got 3 levels. early childhood education and care and early intervention, community and system level intervention, societal and structural level. Interventions targeted at one level only are unlikely to be successful to achieve sustainable change. We need to intervene at multiple levels. That's the message of the social change that has occurred. So there's the Bronfenbrenner kind of model. Our three levels are the child and family level, which is the level that many of you will operate at, community and service system level, which is the place-based stuff that we want to talk about, and the structural and societal level. Child and family level is, well, we want to provide high-quality, inclusive early childhood education and care services, blend early childhood care and education, provide integrated child and family centres, create family-friendly early childhood service environments, design and run services in partnership with those who use them, and provide evidence-based interventions, etc. At the community and service system level, so that second level, we want neighbourhood and community service level interventions, services. We want place-based approaches and whole of community or collective impact initiatives. Whether or not they're the same thing is one of the debates we would like to have. And at the third level, we want to address the conditions under which families are raising young kids. That means housing, it means finances, it means social support, it means a whole raft of things that either support families in doing what they would like to do with their kids or undermines their capacity. We need to develop new ways of working in partnership with communities and services. How do we engage a whole community in addressing their needs? As a service system, how do we do that? As a government, how do we do it? As Marie said, she hasn't yet taken it to Treasury or to the head of her department to talk about how that might be done. But it is the step that we have to take. Raise public awareness regarding the nature and importance of the early years. You guys don't need any persuading about this, but maybe the general public still does. So this brings us to place-based as one of the strategies. Place-based, whole of community approaches. And they involve collaborative efforts to address complex issues experienced within geographic area as a neighbourhood or district. And we have not done a huge amount of this kind of work before. We've got some good examples that we can talk about, and Michael is going to be talking about what's been happening in the States. So it's a collaborative effort, it's got a geographic base, and it's addressing complex problems. You don't need a place-based approach if you're addressing simple problems. Many different terms have been used. It's been called comprehensive community initiatives and collective impact and community economic development, complex adaptive systems level, etc. And it's been applied in a wide variety of fields, including economic development, environmental management, public health and poverty alleviation, etc. So we're talking about a whole school here of approaches. And we're going to focus in our discussion here, obviously, on improving outcomes for young kids and families. What does it look like? At this stage, there is no definitive best practice form of place-based approach. There's a couple of other reasons. Some of the reasons I've mentioned already are about the changes that have occurred in society, the arrival of complex problems, the poor integration, the difficulty we're having reaching families with multiple needs, etc. Here are some other reasons why a place-based approach might be what we opt for. Place shapes people's well-being. Children's environment, their daily experience of living and learning in the physical environment, their home, their community, etc., affects their overall well-being. Growing up in a neighbourhood characterised by general community neglect negatively affects their outcomes over and above the effects of family socioeconomic status. Where you live matters for you as well. Feeling connected and having social networks matters for people's well-being as well. Children's welfare and family functioning crucially depend upon social support. and social isolation is a risk factor for both child development and family functioning. You get less child abuse when the family is well supported socially. So when we're thinking about the whole kind of package and the direction in which Marie was talking about the department going, we need to think about that as a factor. What's the preventive stuff that we should be doing collectively, not just you guys as frontline service providers, to address this kind of issue? Social support is also linked to a number of child and family outcomes, including low birth weight, which is a risk factor for later problems, child abuse and neglect, maternal adjustment, mental health and physical health. All hard evidence. Some communities are trapped by locational disadvantage. Australia's had good economic growth, but some communities are caught in a spiral of disadvantage, etc. And while social disadvantage becomes entrenched, a disabling social environment can develop, leading to intergenerational disadvantage. And you guys work in some of those environments. We've had the economic collapse of certain localities as a result of the local economies being devastated by globalisation and economic rationalisation, restructuring, closing of manufacturing industries. That's happened here and in all developed nations as that kind of work moves offshore to where labour is cheaper. And one of the reasons why the stakes have risen is that means there are no longer jobs for the people who previously mightn't have arrived at school knowing well prepared, but who could still get jobs even if they left school at 15 because they work in manufacturing. We haven't got those jobs any longer. Manufacturing, increasingly highly technical kind of work. So everyone needs skills. Some of these neighbourhoods have become almost entirely dependent on welfare benefits and publicly funded services. We've been doing some work in some of these. We went to one of these impoverished areas in Brisbane where they said they reckon it was possible for a family to get a free meal every day in this locality from a different place. You get these high saturation of services in some of these disadvantaged areas, none of them connected with one another. Okay, these different forms of place-based approaches that we're going to be talking about share certain features in common, but also differ significantly. The core features are that they focus on a defined geographic area. They involve coordinated efforts to address agreed goals. They have actions adapted to local conditions, and they have a governance mechanism to facilitate joint planning. Features on which forms of place-based approaches differ include the size and nature of the geographic area. What does place mean? I think place needs to be defined by the people who live in it, but some of the place-based initiatives are much bigger than that. So are they properly called place-based? Should we be calling them collective impact or whole of community or what? The age span. Some focus on the early years only, getting kids ready for school. Some have a cradle to career approach. The extent to which the process is controlled by government and or the service system rather than involving community engagement. And the extent to which the focus is mainly on coordinating the service system rather than adopting a more comprehensive approach that also addresses the need for community support and some of the other multi-level approaches that I was talking about before. So these are all continua on which dimensions, on which place-based approaches may differ. So here are some place-based ones. Our service has been involved with a whole series of these over the past 10 years, including Communities for Children initiatives and things like this. But these ones are going further than that. So I'm going to talk a bit about Go Goldfields, Blue Mountains, North Sydney, Children's Ground, Tasmanian Children's and Family Centres, and a couple of research-based projects which are of interest. And this is not a comprehensive list and so on, and I hope that in the workshop Michael and I will do this afternoon, we'll get an opportunity to hear about more. And we've got people representing some of these services actually here. So we'll have their contribution as well. Go Goldfields is Victorian, Bendigo area, innovative alliance of organisations in the Central Goldfields Shire in Victoria, created to deliver locally relevant responses to social issues that are too complex and too long-term for previous. So there's that tuning into the complex problems issue. The aim is to ensure people in the Shire, particularly children and youth, can participate fully in social, economic and physical opportunities. Participation is the driver of development and essential for health. It is the key to the way we need to think about this. Supported by the Victorian Government, but it's run by the local Shire. A series of Shire-wide community-driven approaches to improve that. It's a strategic place-based approach targeting the whole of the community. So it's got stuff that looks at families, but it's also got work that addresses other people in the community. A whole of community approach. Blue Mountains and the Stronger Family Alliance. I think we have Di Jackson, who's out of the room temporarily from the Blue Mountains, and Tanya James, I think, is here as well, representing the Stronger Family Alliance. So this is a network of government, non-profit and voluntary organisations working together to support families across the Blue Mountains. And one of the service networks operating under it is the Blue Mountains Consortium, committed to providing best possible support for children, particularly those who are considered vulnerable because of their circumstances. And our network, they say, is powered by discretionary energy. There's a lovely term. I'd love some of that. Is there any way I can tap into it? We are like-minded professionals willing to go beyond our job descriptions to find new ways to create a resilient and supportive Blue Mountains community for children. A very nice sentiment. There's their governance structure, with the alliance in the middle and the different working groups, the Blue Mountains Consortium down the bottom in the middle, and they've got a Child and Family Action Plan. So this is a collective plan owned by everyone, which, and it's got three focuses. It's going to focus on strengthening families through neighbourhood services and systems, moving children and families beyond vulnerability, and creating child and family communities. So you get there a sense of this ecological approach, strengthening families through systems, actual services and systems, and then these other issues which are trying to look at the conditions under which families are raising young kids. North Sydney Community Investment Collective is brand new, and it's a government-sponsored thing. It's a newly established group that arose from efforts from senior department executives. So this comes from a different perspective altogether. And this arose when I have trouble keeping track of your changes in your government. Was it the O'Farrell government that came in and did away with regions and created districts, thereby abolishing the mechanisms that the government departments had for linking together? This is what they've been working on, and we've been doing some work with these senior executives. The group has established a multi-agency community engagement board for the district, as well as a cross-district community investment collective and a thought leadership group. All that you can find at the moment is a YouTube clip of their launch. But this is an interesting development. It doesn't matter where these things start. This is starting top down. It's got no community involvement at this stage. It's a question of where they end up is the interesting thing. Children's Ground, totally different. This has got sponsorship, was originally had support from the federal government. Children's Ground is a locally led and designed place-based approach working in Australia's most disadvantaged communities. It starts pre-birth, provides a complete integrated system of high-quality services, etc. Its first partnership is with the Mirarr people in the Northern Territory. It's in Jabiru. And it is a public-private partnership in that it's, although it had seed funding from the department, and Sari Renkin, who you will hear from in the in the panel was a key person in the department at that stage, and it now has funding of, I think, 14 million philanthropic funding to do this work. But it is a genuine partnership. There's its key principles, etc. We might get a chance to say some more about it in the workshop. Then there's Tasmanian Child and Family Centres. This is here. This is done partly through our centre, partly through the Tasmanian Early Years Foundation. Their aim is to improve the health, well-being and care of Tasmania's very young children. They've been established in 12 disadvantaged communities across Tasmania, and the process of community engagement has been guided by a learning and development strategy. They're here because this group and Children's Ground have done community engagement better than anyone else that I've seen. And this is owned by the community. These buildings were designed by the community. The community have been tremendously empowered. I'd love to talk more about that. We'll talk about it. Now, the two research project, we've got our Blue Sky research project, which has explored how a revised service system that focused on young children that addressed inequalities could actively and positively shift children's development. So it's taking a particular area, western suburbs in Melbourne, and trying to work with the service system. That map I put up earlier was from that project. And a key focus is to view the child's journey through services from the family's perspective. What Marie was referring to, not the service perspective. What did it feel like to be a family? And can we design a system that works for them? That's the one I put up before. This is what they're aiming at. Something much simpler to work through. So they're currently working on that. And then there is the integrating the conditions for collective impact. Can't even read that. What's it say? Transforming the child. This is done by Ross Hommel's group. Ross Hommel is from Griffith University, but it's involving 6 communities for children's sites in New South Wales, built on the CREATE model. The project aims to build a set of structured processes and resources to strengthen the developmental system in socially disadvantaged communities, to make sustainable improvements in the welfare of children. So what's the evidence to support this kind of stuff? I always start with our program logic when we're talking about evidence. You can't talk about evidence without a program logic. The program logic, I think, looks something like this, and I'd love to debate this in our workshop. If we build a partnership with all stakeholders and gain a collective commitment to agreed set of goals, and if we develop an action plan that improves the conditions under which families are raising young kids and provides them with direct services that address their needs, and if we implement that plan in partnership with families themselves in a way that continuously adapts to emerging child and family needs, and if the strategies succeed in building the capacity of families to provide children with care and the experiences they need to flourish, then we'll see an improvement. Do we have evidence that it works like that? The program logic like that makes it clear that building a partnership is only the first step. It's what you do through the partnership that is actually going to make the difference. So the action plan and the evaluation is a complex business. I'm going to flick through this a bit quickly. I'm going to say to you that basically there is evidence that partnerships are effective and that you can get some good results, although they are not easy to build or sustain. And there are some negative impacts if you don't get it right. But basically it works. Do we have evidence? The features, Mike will talk about these. The US collective impact features of the kind of work that have been done there identify these kinds of features as being important. And included upon that is the one at the bottom, dedicated staff, capacity and a support structure. We need to make this stuff work. Our Blue Sky resource certainly found that you need a governance structure, a governance mechanism to support the work in doing integrated work. As yet, there's limited evidence that interagency and community partnership improve outcomes. They improve interactions at the service level. Can we improve outcomes? We're still working on that. But that is not a criticism of a place-based or collective impact approach. It's a comment on the difficulty in turning the curve, in making a difference to complex problems. We can turn the curve with regard to some things that we can see results from. We want to change vaccination or breastfeeding rates or some of these kinds of things, we can see a change. If we want to change family violence or low birth weight or child protection, those are complex problems that are going to take a lot longer for us to work out. We're still at an early stage in the use of this strategy, and it's difficult to know how best to address complex problems. So the response, no, I'll skip that. Conclusions. Many of the problems currently faced by society, services and families are complex or wicked problems. And under these conditions, traditional evidence-based programs are not capable of making sustained changes in outcomes for children and families. That's the critical message. Doesn't mean they haven't got a role to play. They very definitely have, and evidence-based programs are an important part of it, but not on their own. What is also needed is a realignment of resources, services and policies to address the conditions under which families are raising young children and the informal and formal resources available to them. Place-based approaches offer a way of doing this. Although we've much to learn about how to implement these and other forms of place-based approaches effectively, they show much promise as a means by which we may be able to concentrate and coordinate the services and supports. So we'll be looking forward in the rest of this to a debate about these issues. Website, there's an Australian website, collective impact website, 1020 Foundation, you'll hear about from Sari Rankin. There's an American one there, Michael's place as well. There are some resources that our centre has produced in recent years around place-based. Thank you very much.